Stand up.
We can withhold the recording for 5 minutes, let others join. The moment it with you for all your increment of knowledge. So this is good evening, all of you. It's MK Sastry from India, and welcome to you to another class of the how we recover a patient, how the fellowship continues, and all about the relevant details. So this is a medical science which speaks about the evidence-based treatment, right? Anything which does not have evidence does not stand on here. So when we speak about neuroacupuncture, whether recovery is possible, how far the recovery is possible, what are the relevant procedures have been done, and how you can develop an independent mindset. That is the most independent thing. Allowing everything to happen with independent thinking, taking an independent approach is what is required, right? So when I speak about this patient, he's around 75 years old, right? He's 75 years. Now, this is a patient who was treated by the best of the hospitals in India. So it is Manipal Hospital in Bangalore, which is known as renowned for its medical facilities. Yes, it is renowned for its medical facilities, and it is considered to be among the top best hospitals of the country. Its ranking is higher than the Apollo hospitals, right? So this patient, whom am I speaking, he has been suffering from severe contracture with myelopathy, post-myelopathy surgery, right? This is what I spoke. Huh? If you don't treat spondylitis and sleep this properly, you are going to have myelopathy. So we will be speaking today about endoscopic surgery, little bit miss. It is not your missus, right? Not your girlfriend. It is miss. Minimal invasive spine surgery method. So in endoscopic method, this is the slide is prepared by the class was of my very good friend from Egypt. He's a renowned neurosurgeon. And he has taught this class in AIMS Ahmedabad. And he was very kind enough to give me these slides. So before this slide, we like to go through this history of a patient who had a stroke, brain stroke in 2019. When did he had a stroke? 1 minute. Hello, hello. Yes, a neuro hospital. So this is a patient who came to our clinic after suffering from. When I went to Bangalore, I saw this person, and there he was seen by me and Mr. Avinash, who's my very good colleague right now, who was my student now has become my colleague. It's very beautiful to see the flowers and trees coming up very fast. And he has become a consultant in a very good hospital, Pannan Hospital in Bangalore, right? But this was a case which was a very difficult case because it was in advanced stage and it had two comorbidity. One is myelopathy, one is contracture and spasticity. So he had a fixed hip and knee deformity. What he had? Hip fixed and knee deformity with grade 4 osteoarthritis. So when the patient is on the sleeping bed, you develop a lot of problems in these cases. And this is among one of those problems which we faced in this patient. Are you able to hear me? See, one
Yes,
person should say something, something. One person, right? Who
yes,
is not
sir.
surrounded with voice. Otherwise, I think that I don't know if someone is hearing. Yes, sir. Okay, sir. Something, something should say, Baba.
Yes, sir. Yes, sir. We can clearly hear you, sir.
You are
So, in between, okay, okay, yes.
okay.
But
We will tell
just
you.
something.
We can hear you
Just
loud and
otherwise, I
clear.
will think I'm speaking. I don't know whether it is disconnected, connected. I don't know anything.
Correct,
I'm
sir.
just going with the flow of my language. I close my eyes and I keep speaking, and when I come to open my eyes, the internet is already gone. You are gone, and I keep continuing speaking, right? So after every 1 minute or 2 minutes, okay, sir. Okay, sir. Right.
Okay, sir.
Okay, sir.
Yes. One person, okay is enough. Yes, anyone can say, okay, sir. One or two people, okay, sir. So that I can understand that you are hearing me. Otherwise, I'll also sometimes what happen, after speaking in the class, I feel sleepy. So you have to, when you see that I'm sleeping, and then you must say, sir, please wake up, you are in the class. That also is your duty to wake me up. Okay, fine.
Yes, sir.
So this is a patient, 72 years, he was a sarpanch, twice elected in his village. But because they do not know how to manage their health, he developed at a very difficult stage. One you can see, say cervical and thoracic myelopathy, say cervical and thoracic myelopathy he had. So because of that cervical and thoracic myelopathy, he developed spasticity. Again, the biggest problem was that this patient suffered from a brain stroke. So, being suffering from brain stroke here, I was admitted in multiple hospitals. So, the best hospitals of India among this was St. John's Hospital in Bangalore. I think some of them are from Bangalore. They might know about St. John's, right? I think some of the people know about St. John's Hospital, right?
Yes, sir.
Mm.
It is one of the top hospitals, right?
Yes, yes.
So, Manipal hospitals are also among the top hospitals, right? So this patient was admitted in Manipal Hospital with hip and joint flexibility, deformity, and then there was no movement. He was totally in a flex position, like totally stiff position, many chair. So you cannot move him. He was unable to walk, and uh, and this status continued for how many years? 5 years. How many years?
5 years.
Recording in progress.
How many years he was on bed? 5 years. Now, as per medical science, if you speak, as per medical science, anything which crosses 6 months in post-stroke becomes difficult to recover. Now we had two problems here, three problems we faced here. It was not a simple brain stroke case, right? It was not a simple myelopathy case. It was a case of including both post-operative, myelopathy, cord compression, nerve degeneration, muscle wasting, bedridden for 5 years, has gone through multiple procedures, and then he came to us. Now, can you think this person can walk? At the age
No,
of 72 years, can you think this person can walk?
no, sir. Very difficult.
Why did you think it is difficult?
So the age is so much, and time is so much time is gone out. How can it?
But did I think like you?
No, sir. You don't think like that. I know, sir. There is nothing impossible for MK Sastry, sir.
No, I never considered something impossible or not possible, right? That is not my statement. My statement is, can something be done? And I believe, yes, something can be
Yes, sir.
Done.
done. And with that effort, we try to recover the patient. Tomorrow, I think it's Saturday, and I will show you how stem cell therapy and all combination recovered a girl from Mumbai who was referred by one of my patients, Dr. Yadav. He's an Ayurvedic physician and also practices acupuncture and other things. He is doing a wonderful work in Thane, having multiple clinics. And he referred me this girl of 15 years with cervical cord injury with cord compression and spinal cord injury. So tomorrow I will be speaking a combination of stem cell therapy and spinal cord injury, right?
Yeah.
And today I will be speaking about this spasticity, and then we'll be speaking little about how endoscopic surgeries are done. So what is the difference between the early surgeries and today's surgery? Olive and all will be teaching you. I told you, no, we'll go through lot of things during these procedures. So that when the neurosurgeons are telling you about the case histories, this is a patient, this is what treated, he was treated by olive, he was treated by tea leaf, he was treated by endoscopic, he was treated by open. Then you can directly question, so why we have not taken tea leaf procedure, why we had gone through open procedure, why he having so much pain, How can we recover the pain? Is it a scar pain, internal injury pain, or nerve compression pain? All this has to be identified, right?
Yes, sir.
So when you speak about something, you must be in a position to say that whether it is a right thing or a wrong thing, right? So you must be able to tell whether it was a right thing or a wrong thing and how it happened. That is the most important part of the case. So in this case, if you see, the entire case was a very challenging case, very difficult case because Botox and everything was given. And it was very big difficulty for us that after giving multiple procedures, surgeries, can you recover a patient? Treated by the most super specialist, renowned physicians of the country. And after admitting him for 3 months in St. George Hospital, the moment you see such type of record, already the physicians become demoralized. He says, what others cannot do, how will I do? Right?
Yes,
And
sir.
there comes an independent thought. If you see a problem, it's a big problem, but if you try to solve it, it's a small problem. So here you see how a very difficult case of spasticity treated by super specialty hospital. So you will see the journey and what is the statement of his son and why people become frustrated. All these things will come in this case review. So this is called a case study which we are going to publish in an international conference. And it will be published in an international paper. We have already published this year 3 or 4 case studies. One is in Cambodia, one in what you called Congo Neuro Conference. And today we are speaking about this part, right? So here you can see. Can you hear the voice?
Yes, sir.
Yeah, there is no voice
Yes,
right
sir.
now. You can see
Clear voice,
the
sir.
CVA, myelopathy, all you can see, the credentials of the hospital, right? So this is the St. John's Medical Hospital, which you see, treated by Thomas Matthew, is a professor and head. Can you hear the voice? Can you hear the voice now?
No,
Yes,
no,
sir.
sir. No, sir.
Even
Video का voice video का voice नहीं
video
है, sir.
voice, can you share?
No,
Yeah,
no,
no
sir.
video voice.
Video
No
voice,
video
can you
voice,
hear?
sir.
No, very
No,
clear.
sir, no.
Clear.
Huh?
I can hear you very well.
No,
No,
can
sir,
you
no.
hear the video voice?
No,
No,
sir.
sir,
There is
no.
no video voice.
No, sir.
How to make it video connected this voice? I don't know. Let me see if I can do. Can anyone guide me?
When you want to share SASPG, before you share, it
I
has a
already
button. There's a position where you can share sound. So you have to put share sound. Then it will now go. So you
yeah.
have to go back to share, stop share, then start to share when you
I
before you
stopped
share
the share. 1 minute again. Okay, now I've stopped the share.
Take a Roman there. Stop
I
it.
go to the share.
Then you
This
see
is the
there's a
video.
where there's
And
share
then,
sound. Share sound.
but I press the
Yes.
video. I press the video. Okay.
No, before you press the before you press share,
Yeah,
share
there's
sound.
the share
एक
sound.
नंबर
Yes,
Yes.
right. Right.
एक
Share
नंबर
sound,
एकदम
right.
दादा दादा खुश
Okay,
हो
then now you
Right.
share.
है ना
Are there And this
Now
is
can
the
you hear
case
it?
of post-operative myelopathy.
Yes, sir.
Yes,
Can
sir.
you hear now?
Yes, sir. Yes,
Can you
sir.
hear?
We hear you.
Yes,
Thank you for
sound is
teaching
clear
me
now.
one more new.
Yes, sir.
This is how you learn. You learn every day. You practice every day. You learn one new thing every day. Thank you, Wali. Always my helper. Right.
With CVA, cerebrovascular accident. And when the patient arrived here, patient जब वापस आया उसको myelopathy था, cord compression था, and edema in the cord था, it's a post-operative case. But thereafter, post-operatively again he developed fixed deformity.
Fixed deformity,
He
right?
developed flexion deformity in both right and left hip and knee. अगर आप देखा चाहे, the patient has already developed grade 4 spasticity. Right was greater than left, but on the moment when he gave, left has become greater than the right. Operation of spasticity was done. Operation किया गया था. Hamstring was released. This was released. बस post operatively care नहीं होने के कारण patient has suffered from the reback stage. It has bounced back. अब देख सकते हैं कि इस पेशेंट को सबसे बड़ा प्रॉब्लम था. He was not in a walking position. Even you can see lot of wasting of muscles are there, but still you can see the movement has arrived. The flexion deformity has been recovered. You can see the patient is moving his limb, and now today you can see with support the patient is walking. आज आप देख सकते हैं patient with support walk कर सक रहा है. We thought of doing any surgery, but then because of his advanced stage of 75 years, we did not thought of doing any surgical procedure. Non-invasively, the patient has recovered at a very significant level. Yes, much treatment was much more required to give him a stable condition. थोड़ा treatment का और जरूरत था patient का stable condition के लिए. But then situations are like that, so we have to move ahead with the situation. You can take his son's statement, how he was and how much recovery he can get, and you can see the patient is walking with mild support.
My name is Amarnath Reddy.
Ah.
So my father is Govind Reddy. So 2019 he was being paralyzed, and we have been gone to multiple hospitals like
Including St. John's.
St. John's is first we admitted for 2 months, Sakra Hospital, Nimans, Manipal. So there was no, drastic changes happened. So everywhere we go, we are being suggested to take a physiotherapy and just take a couple of tablets which are being mentioned. So we continue to do that, and recently, just a year ago, we have been suggested to go for knee correction, which is on the right side. So we have done that, post that, still we haven't seen the progress. Hence, I got a call from my brother-in-law that there is a where you can get a good treatment. So hence, I have visited here for the treatment, and he is progressed well. We have been almost close to 3 months here, and comparatively he is doing good job.
And today we can see him walking with the
He is walking with
support, which was absent for last 5 years.
5
You can
years.
see at the advanced stage when the patient was bedridden for 5 years to 2019.
2019. Yes.
So we are in 2024, almost after 5 years. You can see the patient is walking with multiple degeneration. You can say osteoarthritis, hip and knee deformity, permanent deformity was there, contractures were there. सब कुछ होने के बाद, even permanent deformities were there. There was no movement in his leg when he came here. It was like this totally. And today you can see the same patient walking with support. Much treatment, much has to go ahead, and we have advised how to go ahead. But you can see at this place he has recovered at a significant stage. The patient is walking. 5 साल बाद जो पेशेंट चल नहीं पा रहा था, you can see 2019 में bedridden हुआ था, and he was continuously bedridden for 5 years from 2019 to 2024, and you can see with myelopathy, sleep disc, contractures, paralysis, multiple CVA, brain stroke, with all the conditions treated in the best hospitals of Bangalore, St. John's, Manipal. You can see now the patient is walking. After 5 years of treatment, bedridden stage, this patient is walking. And this is a wonderful stage we can see. Let me speak something.
Yeah, this is the condition of the grade 4 spasticity.
Develop into contraction.
Developed into the contraction, complete flexion deformity was there in the hip and in the knee. And we have significantly recovered this patient. This is the big achievement for us.
Yes, this is a big achievement because he was treated in multiple, the best hospitals of Bangalore. He was treated in Manipal, St. John's, Nimhans, and whatever the best hospital we can, Sikara. So these are the best hospitals of India if we tell. Nimhans is the best hospital in India. Manipal is one of the best hospitals in India. And from there the patient has arrived here. On the bedridden stage was, and today you can see from bedridden stage to walking stage you can see. Waking walking. You can see. Even after having multiple surgeries, he was not able to walk. Now you can see the patient at the age of 75. And more important, he was sarpanch. Sarpanch, na? Okay. Okay. Yeah. One time sarpanch or two times sarpanch?
Single word of president 83 no.
83.
Single word of president.
Two times sarpanch. Ah. Sappa maar ke paisa. So here you can see a very critical case being recovered. ऐसा केसेस बहुत रेयर होता है जहाँ मल्टीपल सर्जरीज फेलियर होने के बाद, मल्टीपल प्रोसीजर्स, मल्टीपल इंजेक्शंस, बोटॉक्स ऐसा फेलियर होने के बाद you can recover such a patient in a very low cost, and this is what was our ambition. कि इस तरह का patient recover होता है. We can see, we have seen the records of the patient with flexion hip. So you could see this case. Now you may put up questions for this case. You have seen this case very well, right? So this case was having myelopathy. Whenever there is myelopathy, we assume paraplegia. With paraplegia, if the patient is bedridden and the muscles are not properly used, you become completely paraplegic. Then comes the spasticity stage, grade 1, grade 2, grade 3, grade 4. And when you have a severe massive brain stroke, you go to another drastic stage and change. इसको बोलते हैं हिंदी में नीम चढ़ा ऊपर से नहीं करेला ऊपर से नीम चढ़ा, right? Am I right?
Yes, sir.
हिंदी करेला ऊपर से नीम चढ़ा. वो करेला ऊपर से नीम चढ़ा means Kerala, I don't know what you call it in English, and neem you know. So if you mix both the bitterness, it becomes a thorough bitter subject. Huh?
Sir, how much one treatment is given, sir?
We took around 2 months. We took 2 months.
Okay.
Because he was in a very bad stage and he had multiple infections when he came here. The most difficulty we face in this type of patients are they are bedridden patients, they don't drink water, and they are from villages, right? So in villages, the awareness is very less, so we suffer from multiple problems in the villages, right? So the surgery would have been successful if the braces were put up for continuously, if things would have been done very nicely for this patient. But then, to our bad luck, we only saw what you called all bad lucks to our side. And we took the case. I said, there is only one good luck, my thought. I always said myself, I have only one good luck, it's my mind. And rest everything is a bad luck. And then one thing I said, Bismillah Rahman Rahim. So whenever you say Bismillah, I always realize some insight comes to your mind. I truly believe in this word because whenever you say Bismillah, it says that you start in the name of Allah, the one who is the creator. The moment this feeling comes and the intention becomes clear, your mind and thought process becomes in a flow. The flow out of the fear, right? You come from the fear of your mind that you cannot achieve these things. Because after going through such vast documentation, can you believe this patient will recover? After being treated by the professor and HOD and St. John's for 3 months and all the relevant professors, definitely any good person. See, those who are putting off their cameras, please don't ask me to put their attendance. Mark absent, total absent.
You might be
Sir,
dancing in the room. What I know.
Sir, Surendra Malali is disturbing, sir. His voice
Huh?
is Surendra Malali. Voice disturbing, sir.
Sorry, sir.
Hmm. My voice is disturbing?
No, sir. Surendra Malali. He is muted, sir.
Okay,
Okay.
it's okay. Yes, I muted his mic. Fine, no problem. Balaji, sometimes things come, we have to mention it, right?
Yes, sir.
So, so now, so what do you think when you take this type of cases? What are the things in the mind they come? That is important. That there is a flow of thoughts which sit from fear to recovery. So you can see a patient totally bedridden, 5 years of bedriddenness, going through multiple hospitals, multiple procedures, multiple surgeries, and then can you believe in a small setup he will recover? So what you need is the same thing what I will say. The next slide of Salma Al-Mosi. Dr. Professor Al-Mosi is from Egypt and is a very good neurosurgeon. I know him since last 10 years. How many years?
10 years.
Yes. He always says master or faster. In spine surgery, if you make a little mistake, you are drastically gone. You burn your hands, right? And when you are in what you called anyway, before going to his master or faster, the slide of endoscopic spine, which was taught in AIMS to all the neurosurgeons, we'll just have a look on this, right?
How much time it takes to recover the patient?
See, it depends because all these people they come from multiple infections, right? Especially UTI infection, high fever, fever spikes. It's just they don't come with one stable condition that we only have to treat this. Severe pain, fear, anxiety, depression, the level of confidence, the low emotions. You get every negative mark. If you have 12 subjects in this subject, you will see out of 12, everywhere you will get E grade. Not even pass mark. It is just like when you assess the patient psychologically, damn.
Yeah.
Physiologically, damn. Mentally, damn. Damn means damn means damn. See, whenever you speak about whatever, I don't know your name. You have to please mention. Whenever you ask a question, you mention your name.
Sir, this is Amit Lalani here.
Whoever is asking question, please mention the name.
Hello, good evening, sir.
You are
This is
writing,
Amit Lalani here.
huh?
Amit Lalani.
Oh, Lalani ji.
How are
Lalani.
you?
See, thank you so much, Lalani ji. Lalani ji is fairly well known to me. He's working in Green Angels Hospital. You are the same person, huh? Lalani ji
Yes, sir.
from Green
Yes.
Angels.
Yeah,
Yeah,
Clinical
it's
Global Hospital, sir, Hyderabad.
yeah. Yeah. So he also referred me a very difficult case of transverse myelitis. The patient was having no sensation below the spine. The ladies, I will show the video, I will upload the video, and you will see that lady was unable to walk. Totally, she was discharged from ICU with all procedures done. And when you see below C5 or C7, she was having no sensation. And
Yes,
that
sir.
patient started walking. And that patient was referred by Lalani ji to me. Even Lalani never met me, but we are good that we know each other through social media only. I have never seen his face also. So better Lalani ji, you can open your camera so that I
Yes,
can
sure,
show you
sir. I
from.
will.
I want to see you for the first time.
Just a second, sir. Came on.
So Lalani ji, we are going to propose a marriage for Lalani ji. He's unmarried boy from Gujarat. So find a good girl and get him married. And 20% what you called uh, dowry is mine, okay? Before he comes to camera, you can take his photo and put up in all the Facebooks. So Lalani ji had a very important question. What was the treatment? It was a multiple treatment which we have undergone. Especially my best treatment for brain stroke is brain mapping and neurostimulation, nerve stimulation, opening the pathways, and then I like to go for little bit low dose of Botox therapy. I like to go with mm, good rehabilitative procedures. We like to Lalani Jai
Sorry, sir, I
Kuchi,
got
very good.
disconnected.
But I think you are married, so my
No,
dream
sir,
has
no, and I
scattered
am not
then.
married, sir.
You're not married. Then okay.
Then
20%. There, I request all the panel members of the what you call it's a very Gujarati boy. His father has called me to find a girl for him. So please post his photo in all the Facebook looking for a good girl. So not so a good doctor earning so not so money. In Telugu we call it 2 crore rupees dowry is demanded. 2 crore rupees, 20% is mine. Once I get marriage, I can take a retired life. With the marriage of Lalani, I'll have some money. So we have decided to open one what you call matrimonial society in this group. All young boys coming here, we'll post them, we'll get a good girl, 20% my commission. And after having 1 crore rupees, I can retire. No teaching, nothing, just going to ashram and live a life. This is what the brain status of this person was. The status of the patient of this was having a massive stroke. Large number of neurons has been dead with contractures, and then the surgery was done to this case for relieving. But then the patient was from a village, so proper understanding of the case was not known to the physiotherapists who have been working with this case. So the braces were not put up. So when you operate such type to release the spasticity where it's a fixed deformity is there, and if you don't put a braces, it it bounces back. So you start from 1, you reach 9, and there was a game in Ludo. Ludo, you know Ludo? How many people know Ludo? Sap, Sidi, Khel, Snake, and this one.
Yes, sir. Yes, sir.
Yes,
I
sir.
know.
Yeah.
Yes.
Yeah.
Yes,
So it
Sir,
was just
Ludo.
like,
American
yeah.
movie.
So yeah. So he was just about to reach his turning point of recovery, but suddenly he had a snake bite and he went to square one.
What up?
He went to, instead of climbing ladder, he went back to bounce back theory. It is called what? Bounce back. Yeah. So that is why it is very important whenever you take a case. Two things I want to tell you. First of all, never discourage yourself fighting the fights and never be over ambitious. In my life, I have learned two things: never be ambitious and never be discouraged. Things will go good, things may happen bad. It's just like ECG graph. So, so those people who were saying brain mapping does not work, brain stimulation does not work, the pains does not work, all the questions which were put up, I was just laughing. Then do whatever you want. What you want to learn from me? I can only teach you my experience. What a physician has his experience. If you don't want to do cystinostomy, go for keratotomy, which has been done from 1805. If you don't want to advance yourself, don't advance yourself. Do whatever you like. It's your clinic, it's yours and your patient. No one is forced to do anything here. Am I forcing you to do anything? No. I have no right, no say, no gun. But I always say that, see, this is helping the people. And ultimately, if you improve your knowledge and improve your clinic, it will help the more people. But the problem with us is our negative thought. We want to take 2 steps ahead, and this is what Jesus said in the. There was a question before we go to the miss. It is not miss, huh? It is not lady, right? Miss what? Lady? It is miss or
Minimal,
missus or
minimal
what?
invasive spine surgery.
It is
Minimal
minimal
invasive spine
invasive spine
surgery.
surgery, right? So endoscopic spine surgery is a minimal invasive spine surgery. And this is a very good class taken by Elmosi. I am not in a position to teach like Elmosi because you are not a spine surgeon, right? I just want to give you some exposure of miss. So, the first thing which you have to understand that if you break a puzzle, Lalani, what will be your approach for this type of patient? Lalani ji, Dr. Lalani, if this type of
Sir,
patient comes, what will be your approach?
Like this patient?
Yes, with this type of patient, what will be your approach?
So in the
What is the
beginning
first line of
phase,
treatment will you think?
so in the beginning phase, we'll have to go for the stretching and all.
Huh? Your voice is not clear. Pardon me, please, sir.
Hello, sir, am I audible now?
Yeah. Yeah, you're audible. Very much audible.
Sir,
Please
in the
carry on with
beginning
your
phase,
thought.
we'll have to go for the stretching and all.
He has been on stretching for 5 years.
Okay, now in this, I thought like you were asking about the beginning
I'm
phase.
saying now, after all this treatment, after going 5 years of regular physiotherapy without mesh, what will you do? He did not miss physiotherapy for 5 years. Stretching was continued. And that stretching only developed great force plasticity. It became upper motor lesion. So, Lalani ji, what is your next thought in mind? What should you do? Yes? Am I audible or it is disconnected?
Yes, sir, you are audible.
Yeah, please tell me, Dr. Sir. आपके क्या विचार है इस केस? Please put some light. Speak whatever you want. No one knows you, so there is no problem. Except me, no one knows. No one knows here anyone, so you can speak anything and you can go out.
It would be better, sir, if you will explain.
Huh?
It would be better if you will explain.
I will explain, but what is your thought? That is what is important. Because you all get chronic cases, typical cases, difficult cases. So, what is your line of thought in the case? That is what is important to know.
For
What comes to your
stabilizer,
mind? Because stretching is very difficult for him. You cannot stretch it. It's spastic. Already undergone Botox. With myelopathy, post-op myelopathy, fixation has been done, has been done. With fixation and enlarged cage has been fixed up. So now what to do in this case? Please tell me, sir.
NCB test and stabilizer.
NCB is Radu. NCB 00. EMG 00. In spasticity, can you achieve any figures in this one? Huh? Yes. Sunil, what is your opinion? Can you achieve figures in NCB test? NCB में कुछ मिलेगा? Such spastic cases? Shivani ji, Sachin.
Stem cell therapy, sir.
Am I audible?
Yes, sir.
Sir, stem cell.
See, this is called the integration of the treatment. You are looking the complexity of the case. Now, but if you make the sandwich of the case, it becomes enjoyable. Lalani ji, समझे मेरी बात? Now,
Yes,
how
sir.
do you mean by sandwich? What do you mean by sandwich of the case? I call it sandwich theory. What do you understand sandwich? Any lady can tell me what is sandwich? How do you make a sandwich?
Take 2 slices of bread and put something in the middle.
Slowly, madam. Slowly. We are not as fast as you can cook. We are slow cookers.
Yeah,
Super
take
weighted.
2 slices of bread.
Huh?
Take two
You cut the
slices of
bread.
bread
Yeah.
and
Yes.
put some
Then?
something in the middle which you like to eat.
So you put some butter and you mix
Yeah.
it with some
Vegetables or egg or
beautiful
whatever you like.
what you call decorations,
Yes.
and then you eat. Same thing I
Yes.
did here. So instead of eating the bread like a loaf, ow, 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 what did I do? I made it into pieces. That is why I see it muscle by muscle, nerve by nerve, area by area, part by part. So when you divide a big problem into small issues, it becomes very easy. So problems as you know, problem says united we stand. Okay. I say divided you fall. I divide it, you fall down. You understood my concept?
Yes, sir.
All the problems are united. Contracture, this, everything is united, right? Am I right, Ladani ji?
Yes, sir.
So what is the answer? United we stand. And
Divided we fall.
ah,
So break
and that
down
is called
problem at
the
a time.
Combination.
Treat one problem. Treat each problem separately and then let them fall.
yeah,
Then
yeah.
form.
You have to break the unity of these problems. So when you do investigation, you have to be thorough of the complications of the problem. So complication is a big word, but under complication, you have to headline what are the problems you are facing. Wasting of muscles, fixed deformity. So use small doses of Botox, small, uh, there is a degeneration of the nerve, so put stem cell therapy. There is a problem in the nerve conductivity and myelin sheath, so use higher PRP therapies on the regular basis. You have infections, so go with antibiotic, prebiotic, probiotics. You have prostatomegaly, so use diuretics. So when you see everything going online, it becomes what? अदिल क्या होता है वो कावा I call it Kashmiri kawa.
Kashmiri Kawa.
It becomes a Kashmiri kawa, very beautiful to drink.
Yes.
So from a complicated problem to a sandwich and with a kawa, if you take, it becomes a beautiful solution to your problem. Am I right or wrong?
Yes, sir.
You're right.
Huh?
Yes, sir.
It sounds easy.
From complication to easy. That is why I say, you always, what do you think? You make everything complicated in your mind. So you always think brain stimulation is very difficult. You always think why to buy 7 pain, why to do all these things. You only question your question and you only answer. The stage is what you never develop yourself. Studies, books, reading, writing, teaching, patients, clinical, everything I do. And then what I say? What do I say? I only say, united we stand, divided we fall. So fall the problem, make it a Kashmiri kawa and drink it. Keep silence, the fight is finished. Sachin was saying me. I asked Sunil, Sunil, what is the problem? Sir, वो चिल्लाती है मैं कुछ नहीं बोलता. Surya Narayan Das, I was asking, why you did not take divorce from your wife? What is the uh, beauty of your relationship? He said, sir, my wife keeps shouting and I keep silence. He is from Odisha. Surya Narayan Das is from Odisha. And he always says, I asked him, Why you did not divorce your wife? Why is your marriage? Married and continuously married, right? He married 75 years back and he did not do a second marriage. So I asked Das, why it is the importance of not getting second time marriage? Yes or no, Surya Narayan Das? Surya Narayan Das, 41. He's not hearing me. He's talking to someone else. Surya, what is see, he's not hearing me. See. So you want to ask many more questions to relevant to that case, or we like to go with Miss? And not you, Mrs. Okay, it is Miss. Minimal invasive spine surgery. Right? So it was said this technical term was given by whom? Minimal invasive spine surgery was given by a lover.
Sir,
I missed his girlfriend. So he said, I could not marry my girlfriend. So I gave it a technical term. What? Miss. I also give many, many moniques. And this many money became world famous. And I missed their various procedures, tea leaf, olive. So gone are those days when spine surgery was complicated. And gone are those days when spine surgery is required. So we have to find two things, which cases are required, which is not required, what to be done, what not to be done. Yeah. Can you see this?
Yes, sir.
yes,
Yes, sir.
spine.
So it is spine endoscopy, faster or master. So whenever you go to a surgeon, we ever to a, people always say, the faster you do, the master you become, right? So with the speed, it does not matter. For example, I try to recover a patient on table, but then issues I have resolved it. I don't do anymore like that. Now I start things. Earlier I used to start from the top and then I used to enter the bottom, right? But then I found lot of problems are coming. The expectations of the patients are going like this, and then they are thinking in a difficult way. So what we started doing right now in a clinic is we create a good foundation so that the other person who is treating the patient get it at a higher level and he can recover the patient. For example, I always say, if you have a very difficult frozen shoulder, you need a very good orthopedic support, you need a Botox support, you need all the master health checkup. All these things are required because you are not having one problem. You might have any other problem also. 2D echo, vascular damages, all these things you have to see. The arterial circulation, carotid circulation. So everything has to be seen. According to me, you cannot neglect any part. And one more thing I would like to tell you today before going to this. A patient came to me yesterday for admission, right? And he said, how difficult is the psychology of the attender? You see, the patient is 75 years and he is to be admitted in this hospital from ICU, who is having ear infection, CVA, recently suffered from CVA. Everything was okay. I said, I'll give all support, radiological, medicine, pharmacy. Okay. The bargaining is over, everything is over, the room is booked. Now he's saying, I will not provide any attendance. And again, second sentence he say, if my father dies, will the money will be refunded? Two thoughts came to my mind immediately. What does he mean? He means to say that, and I said it is Supreme Court guideline. Without attender, you can hire attender from a agency. Lot of people are hired from agency and they are keeping the patient over there. But one person should be there. You cannot say us to keep 24 hours to be with your patient, right? It is not ICU. Even ICU, you pay around 1,50,000 rupees per day, or 70,000 rupees per day. Then you get a full-time nurse. Minimum 70 to 1,40,000 to 1,50,000 rupees per day.
So this part you have to understand, right? That before treating a patient, the psychology of the attender is most important, right? And that is most important part you have to understand. And then second part, what you have to understand is where to start, when to start. And if you are not able to understand, please write down in a plain page what is I am going to do. What are the complications you are finding in a patient, right? So make it two line. This is the page. Divide into two parts. Write point by point. What are the complications you are having, and what is the solution to this problem? When you are not able to answer it, just try to learn. Don't do just go with the stretching. Nothing will happen. The more you do stretching, the more spasticity will develop. Because the stretching is at the local level, but you are injuring the neurons at the upper level. You understood? The muscles, the nerves, they are giving opposite signals. It's just like the more you stretch, the more spastic it will become. That is why in spine surgeries, in neurosurgeries, we always say you should have a good mentorship. A mentor is a person who develops a gold into a ring and has diamonds to eat. And that is the most beautiful part of this theory. Algeria Farid, you have any question for me? Algeria,
Thank you, sir. Can you please repeat the relationship between neuroplasticity and the stretching of muscle? Please, sir.
yes, see. That's how does spasticity develop? Can you tell me? It is at the local level or the neural level?
Neural level.
Huh? Lalani
Neurological
ji,
level.
can you? Yeah, neurological level. Okay. Lalani, any physiotherapist is here? Shivani, can you put some light on what is spasticity and how it is developed?
Sir, it is the severe tightness of the muscle, which is due to repetitive movement, overuse of the muscle.
Hmm. 1 minute, please hold on, huh, Shivani. Hello? Hello? It is, yes. Please, Shivani, continue the definition. Shivani, please continue. Can you hear me, Shivani ji? Dr. Shivani? Hello, am I audible?
Yes, sir.
Yes, sir.
Can you hear me?
Yes, sir.
Yes, sir.
Shivani,
Yes, sir.
please repeat your definition.
Sir, it is the
Your voice is cutting down, madam. Please repeat it. Yeah, please tell me. It is the any more physiotherapy, Shivani? We are not able to audible to you. Please repeat it what you are saying.
Sir, is it audible now?
Yes, sir. Yeah. Audible.
It is
Shivani ji,
the
please tell us.
It is the severe tightness of the muscle in which muscle is not able to stretch or perform the movement properly, and it is because of the overuse of muscle action or by repeated again and again performing the same movement physio that will
So
lead
by
to basically.
repetitive exercise, active and passive movement, you develop a severe tightness because of the overuse of the muscles. Right? So this tightness is developed where? In the muscle or the neural level?
Muscle, sir.
Shivani?
Well, the muscle is involved, but due to the reason is because of the nervous system also. But
Yes.
it is evident in the muscle only.
It is
So
evident
it
in the
is
muscle, but the development takes place where?
nervous system.
Nerves, right, sir?
Huh?
Nervous system.
It takes place where?
The whole nervous system is involved in that.
You're right. Everything is involved. From CNS to PNS to the neural connections to neurochemistry, the neurotransmitter, the G lymphatic system, neuro, the myelin sheath, everything is involved. Hello. So, when you speak about neuroplasticity, so what is the way you can undertake it? The first thing to break the spasticity is, we always say, combination of many things breaks the spasticity. Before it becomes a contracture, you have to break it, right? So, we have to work with brain, work with stimulations, you have to give neurotransmitters, you have to develop a neuroplastic changes inside the. Here you have to improve the nerve conductivity, you have to improve the muscular circulation. Overuse of the muscles develops tightness and it develops from grade 1 to grade 4 and at grade 4 it becomes contracture. Am I
Yes,
right?
sir. Yes,
Yes,
sir.
sir.
Yes, sir.
If I am wrong, please correct me. Physiotherapist, if I am wrong, please correct me. Lalani ji, if I am wrong, please correct me.
No, no, sir, you are right.
So, when you have a multiple complications, you have to develop a neuroplastic changes inside the brain so that all the neuroproteins, the defect of the neural communications are overcome. That is why we say spine can endoscopy faster or master. So the faster does not become a master, and doing delay is also not a good thing. Before the anesthesia level, which is at peak, again during a 8-hour journey. Now I'm teaching you to recover paralysis. There are many ways. You just like going from Pune to Karat by car, by helicopter, by flight, by everything. Now it's up to you what you want to take. Right? You want to adopt traditional systems? Very good. If you want to improvise yourself, you can improve. And if you want to achieve your destination, it's the most beautiful thing which you will do. So if you ask me about spine surgery, what will I perform? I'll say I'll go for MIS. Minimal invasive spine surgery, because it can be performed under local anesthesia. You don't need to go with a deep anesthesia level. You give it at multiple level. The maximum anesthesia dose which you give is metazolam. And under Olive procedure, right? You complete this procedure in how many minutes? 20 minutes with fixation. And the patient can be discharged on the next day, same day. After 2 hours of the surgery, patient can go home. I still remember Abbas's one comment. Dr. Muhammad Reza Abbasi, one of the legendary neurosurgeon, whose photos you can see with me. I was with him for 6 days. And during these 6 days, I was really enjoying the conversation. And he said, spine surgery is a beautiful thing with multiple degeneration at the age of 70, 75. Yes, beautiful procedures can be done. Only the stagnation is what? Our own understanding and thought of mind. Right? So this is not my slide. It is made by Samia Al-Mausi Hassan. He's a very good neurosurgeon from Egypt. And I really enjoy his mentorship because he has given me books of more than 30 lakhs to 50 lakh rupees books he has given in neurosurgery to me. He has given me the most costliest book free of cost. And you ask him, Al-Mausi, he is very genuine and very nice Muslim guy and very, very supportive. So, so now this is called conventional versus myth. So conventional means what? Open, and you see miss. This is what conventional. A very big scar. And when you say miss, it's a pimple on the spine. So this is the conventional. See, such a big scar, right? And this is what? Miss. And more than this, also lesser than this, you can do a spine surgery. And when you see the healing of the wound, it's just like the pimple of the face. You understood? And with fixation. You have a minimal blood loss, you don't injure the nerves, you don't injure the roots, and the outcome is very good. But the problem with us is that we don't know the specialty of the neurosurgeon, we do not know the specialty of the spine surgeon, what kind of surgery he does, and we just jump upon him. Recently, one patient came to me, and be careful with this type of patients. He'll have multiple spine problems, and then they will have myotonia, and they will ask your suggestion. Should I go for surgery? And what is the risk of surgery? You should directly say, the one who will operate you, who is taking the fees of surgery, should explain you the risk of surgery in your case, whether you are a good candidate or a bad candidate for surgery. For example, I got one case before yesterday, in the early morning hours, and it was a neck of the femur fracture. And then they were asking me what to do. I said, see, best way is to do conservatively management and make the patient mobile. And during that, you have to give this tripathy injections and all these things. You have to manage the patient very well conservatively. No infection should take place. And radiological investigations has to be very correctly done because they may develop DVT and everything. And regular master health checkup has to be done because when the patient is on bed, regular lipid profile, triglycerides, everything has to be checked on a weekly basis. This is what our schedule is. LFT, RFT. So whenever you do all this type of cases, be careful with the blood parameters, be careful with the procedures, and whenever you see that there is a miss, the charge, a procedure done by minimal spine surgery, you please see not that one level up or one level down is the impeachment of the nerves, not the has created a problem. The spine weakness, the stromal snort, and all this situation which has damaged the spine has created the problem. When I speak about conventional therapy surgeries, it takes around 7 to 8 hours. But when I speak about minimal spine surgery and olive procedure, it is just like a cup of tea. Which will
Later on, sir.
Nair, Nair साहब कौन सा सर्जरी
Yes, sir.
पसंद करेंगे मोबाइल छोड़ के मेरी बात
Later on, sir.
सुनिए
Later
हाँ
on.
Yawning and all these things is not required in the class. Be careful. You are talking to MK Sastry. You will like to go with which type of surgery? 8 hours or a cup of tea?
A cup of tea, sir.
Please, sir.
I am asking Nair. You are.
I didn't hear properly. What, sir? Please repeat.
Now you will hear. Yeah, that is why I said, please hear me properly. Yeah. You are going for a spine surgery. Extrusion is to level this damage. So you have two options. One is open surgery. One is closed surgery.
Open surgery is somewhat risky factor, 50-50 chance.
No, what surgery you like to have? 8 hour surgery or a cup of tea surgery?
Cup of tea surgery.
Yes, that is what we say.
Yes.
If you don't upgrade yourself, if you
Yes.
don't learn NIBS and all,
Yeah,
you
yes.
elongate the case for 5 years, 6 years, 7 years,
Correct.
and
Everyone
you
wants
spoil the
cup of
case.
surgery.
That is what I said. When I say NIBS, it is MIS, minimal invasive procedure. It's just like a cup of tea. And the procedure which you adopt my dear colleagues, which you adopt is what? Open surgery. It takes 8 hours. Higher blood loss, complications, post-operative complications, foot drop, everything you will see. But in MISS, the scar is less, the problem is less, and when you see this type of small scar surgery, you can understand that there may be you have to be careful with two things when you see a MRI. You should do not see the report at first. See the image very closely of the disc, the coronal section and the sagittal section, right? So you have to see the spaces of the disc very well. Where is the impeachment of the nerve? So most of the people who are saying spine surgery is unsuccessful, it is not correct. And if you are saying spine surgery is successful, it is also not correct. It depends on what you want to. Because the patient which you referred me 4 years back was post-operatively done, but the outcome of surgery was not, right? And that is why we say we burn our hands after doing pieces. Spine surgery is a very good. Here you can see microdissect. 77, Yagacil, Carpel, and Fungus, they developed a very good procedures, and they developed microdissectomy in the year 1977, and this was the paper published from North Bellevue Hospital and Kathmandu University and Long Island spine specialists. So they published this paper, and that is why it became very famous. Some people are speaking on the background, right?
Meshram sir.
Yeah, I have muted them, no problem. So you can see in Japanese, he published this procedure in a regional scientific journal in Japanese language. He was one of the reasons why this procedure did not gain widespread attention among the surgical community, but it was the birth of percutaneous and later endoscopic discectomy. It was great merit of Pravesh Campbellin. So this Campbellin triangle is the triangle which we speak about MIS procedure. We call it a Campbellin procedure, right? What we call it Campbellin triangle. It's a window, it's a safe window which is in the spine by which you enter, right? And you don't damage the spine. There's minimal blood loss. You develop the case at linocaine. You know what is linocaine? Linocaine. What is linocaine?
Local
Anesthesia.
anesthetic.
Anesthesia, sir.
Local
Which kind of anesthesia? A high anesthesia or a local anesthesia or minimal
Local.
anesthesia?
Local anesthesia.
Local anesthesia.
How much is the effect? How much time the local anesthesia effect is there?
45 minutes maximum.
Hardly 20 to 30 minutes,
20.
right?
30 minutes. Sir.
Pain is having higher managed linocaine. But linocaine is the sodium channel blocker. In our hospital, we mix linocaine with bupivacaine. Long lasting and short lasting, we mix together, right? So this is how so now it is the thing which type of endoscope is more better. There are many types of endoscope. Which approach is more faster and which endoscope is the master. So when I spoke to Muhammad Reza Abbasi, he is the one who was a direct disciple of Campbellin. We have seen this page, na? Pravesh Campbellin. And upon him, a Campbellin triangle has been approached. And this is called olive procedure. What it is called? Olive procedure. You go by the Campbellian triangle. There's a Campbellian triangle. You approach that Campbellian triangle, and it has been named after him. And when you go with the Campbellian triangle, you operate a patient with minimal drugs. What are the drugs used? Lidocaine and metazolam. And that metazolam also is given at lesser level at 2 ml or 3 ml with dilution. And the patient can be discharged after 2 hours of surgery. So, I'm sorry, my eyes are also not good. I'm an old man. I cannot read. How to enlarge the skin? Yes, right. So, 74 trials matching spine endoscope in title abstract. So these are some papers which have been published, and you see, this is the importance of MIS today. People are not liking to go with the approaches of higher stem cells, higher therapies. That is why tomorrow when you go to the market and you say, I recover paralysis, I recover neuromuscular disease, you recover the lengthy procedures, I am sure people will not go. People will go with those procedures which are less lengthy, more effective, immediate results. For example, I have a, what, you got trigger point over here. Lalani ji, how many minutes you will recover this trigger point from my trapezius? Lalani ji, Dr. Lalani, are you there or he has left? Any physiotherapist? Any physiotherapist is there? I am not able to take the slide down. Why? I'm not. Yes, correct. I have learned new thing. Okay, yes. So, how many seconds can you reduce a trigger point without pain? How many of you can reduce a trigger point in seconds? Huh?
30 seconds.
Physiotherapist?
30 seconds.
By what procedure?
Acupuncture needling.
Oh, you want to needle on the trigger point? It will
No,
get
sir.
more stimulus. So where will you needle?
For knee pain, LU point.
I'm not. You point. Illa. See, the problem with us is that, see, you have not diagnosed the situation. I'm asking about the trigger point in the trapezius. Trapezius is this muscle, right? I'm having a typical trigger point over here, right? So what is, any physiotherapist would like to communicate with me? Any physiotherapist over here?
Yes, sir.
So traditionally, on the, what you call the camera, whoever is speaking, I think Shivani is speaking, right? Shivani ji, Dr. Shivani, please help me out. Yeah. Please, can you open your camera if you are comfortable?
Yes, sir. Yes, sir. Yes, sir.
No.
Sir, is it,
Yeah, visible. Right. Very good. Very beautiful. Wow. If you see girls with beautiful smile, your energy becomes stable. So, manually, if I want to reduce this trigger point, how much trigger point over here?
sir, in myofascial releases, it will take more than like 10 minutes
10 to 20 minutes.
for manual therapy or myofascial
And
releases.
how much pain you are giving here to what
Sir,
is the
it is
sensation of pain?
quite painful to the patient.
How much pain? Now patient is having 5, 10 by 7 pain. When you give a pressure on trigger point, how much the pain, inflammation rate will increase in the local area?
Yes, sir, it will increase.
7 by 10, it will go to the maximum level.
Yes.
Yes, sir.
Now tell me a procedure in which you can release the pain in just 5 seconds without giving any local pressure.
So by using dry needles?
Where to put the dry needles? On the point? Again, it will
No,
get
sir.
inflammation.
Sir, we can release the muscle by scalp also.
Yes. Just by putting one needle over the ear and stimulating it properly, the trigger point is gone in just 3
Yes, sir.
seconds. Now, who is master and how faster you are? The master your technique, the faster you become.
Yes, sir.
You release trigger point by hand and elbow and cupping and needling, pricking this side again and again. And what I will do? I just take my nail. I don't even use this needle. I just take my just this and I just do like this. And then I say 1, 2, 3, gone, tuck. And the people said, and the knows my magic. I always will do, foo, 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 foo. And they will think I have a Kundalini Shakti. I said, I have a Kundalini Shakti. Pain is gone. I said, yes. And always people will come and tell me, sir, give me your blessings. I don't give any blessings. So whenever the people come, I use my hands and I stimulate those certain areas of the brain. So I do it like this. And that is called non-invasive brain stimulation. I know how much stimulation, how much pressure has to be given. That is called minimal invasive procedure. You are taking myofascial release. It's a conventional technique. When I stimulate it with the needle, with the pain, it is what? Minimal invasive procedure. So which one is good? 5-second procedure and 10-minute painful procedure. Which is good?
5 seconds.
Huh?
5 seconds.
Which is good?
NIBS.
Why?
NIBS, sir.
Why it is good, Mr. Ramji?
Sir, it will take less time and it will also less painful to the patient.
It will create confidence in the patient.
Yes.
Yes. Don't think of losing the patient. Think of becoming a better clinic. This is what Abasi said. Don't think of putting the patient in the ICU for a long time. You are losing a market. But on the same day, if you do 10 spine surgeries, you earn more than what you are earning from the conventional method. Your market is not growing. So by using all these procedures, your market is growing. You grow from 20% to 80% and 100%. So it is called intralaminar percutaneous endoscopic lumbar discectomy for L5S1 disc herniation via intralaminar approach versus T-leaf. It is called transforminian approach. So these are some of the approaches which we take. So percutaneous approach is what? Going and taking out the disc. A conventional method which takes around 7 to 8 hours, 6 hours, 3 hours to 5 hours, right? But if you do miss a transforminial approach or if you take olive, it takes how much? With fixation, it takes how much time? 20 minutes. Which is better? And after spine surgery, where is the pain? Oh, there is no pain. No painkillers. No opioids. Go home. Doctor, I cannot go home. It happened. I tell you, there was an interesting case. 3 years back, you have heard the name Satyam Ramalingan Raju. Anyone has heard this name? Ramalingan Raju? Hello. So his lawyer came to me, right? And I was so excited. He just came to meet me. I said, he's a paralytic patient. Oh, you sleep on the bed, I'll treat you. And after 30 minutes, I treated him and he's gone. His paralysis is gone. And he never visited my clinic. Which is better? Minimal invasive spine surgery or continuous active passive movement and all these things. Ragra bagra, dagra bagra, which is
Really
more
asking
important?
people what is the number one ladies fragrance in the
That
world,
is what you have to decide.
and this was the number one
So
option.
these
This
are the
was
equipments
amazing.
which are used in spinoscope, right? Here you can see how the drilling is done, right? Spine scopes. So it is bipolar endoscope, it is full endoscope, it is micro endoscope. You see the now you are telling me why different pens are required. So this is the reason why different equipments are required as per the approach. Full endoscope, the machine is different. If you want biportal endoscope, the machine is different. You want micro endoscopy, the machine is different. And totally this is different. Can you use biportal endoscope in microdissect endoscopy? No, Radu, not possible. So you can see this is the monoportal approach. You see, it is on the cadaver, right? It is not a live. So cadaver body. So it is a transforminial approach. This is descent to. This is a tube surgery and minimal spine surgery. You see how lamina is cut and how the disc is removed. So there are many procedures in microdiscectomy. What we do, only the extruded part we remove it. But it is very successful if the post-operative procedures are done very carefully. So that is why I'll say spine and brain has to continue in a human life. If you want to grow your clinic, you have to master the two cases, spine and the brain. And that is the motto of creating this fellowship course. If you understand very good things, you can understand what are the procedures. So in discectomy, intralaminar endoscopic lumbar discectomy, IELD, transforaminal endoscopic lumbar discectomy, and translaminar and transpendicular discectomy is required. So this is called the discectomy. That is the disc. The lateral races is decompression, intralaminar IELRD, transforaminal endoscopic, TELRD, familial discompression, TA TELIF, intralaminar contraspinal endoscopic lumbar formectomy. It is ICLIF, unilateral and endoscopy for bilateral decompression is LEULBD. So postlateral T-leaf, so K-leaf or leaf. So the most important I like is transcampylene approach because there is a minimal spine surgical approach, and this is olive, oblique lumbar interbody fusion. So here it is called olive. One of the finest procedure in older patients of 75, 80, and very good.
Olive.
So now you can understand uniportal endospine surgery and the equipments used all are different. And that is why you see the skin insertion is done, then you take this is how the skin insertion is done. Size matters, differential property of hyaluronum and its fragments in the skin relation to this is not required. Most important is the size of the incision is very important because it has inflammatory reactions. So when you go with olive or all these procedures or endoscopic procedure, you don't damage much of the fascia, right? So you can see the normal versus damaged TDF, the fascia. So now when you see the pain in postoperative case, it's not because of the nerve impeachment. It is because of the damage that done in the fascia. You understood? Am I clear to you?
Yes, sir.
Yes, sir.
So here you can see how applied load, how the muscle recovery is very important in postoperative cases. So whenever we do any type of procedure, we don't have the process to revive the muscle. We don't have the process to create a pathway from the brain to the muscle to revive those fascias which has been injured. So when you go with the open approach, you cut, 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 and here you see what has happened. You have damaged the fascia. So when the surgery is successful, because of the internal wounds which you have created, the surgery has become failure. What patient wants is three questions: when I will recover, how much pain I will have, and whether it will be a successful surgery or not. So here you see this lamina. You cut the lamina, you operate. So this is the ligaments and the anatomy of the spine. This is an intervertebral foramen. So whenever that encroached, right? So it encroaches in the foraminal intervertebral foramen in this piece. Where the nerve encroached in this process, right? Where? Here. Can you see that?
Yes, sir. Yes, sir.
So when it's ossified, and the moment this ossification of the posterior longinal ligament, this is the ligament when it's what you called, 1 minute. Hello. Yes. So here you see lamina, right? So here you cut down the laminectomy. If you cut this bone, it is called laminectomy, right? So it is intervertebral foramen. So here is the nerve impingement compresses. This is the disc. So it is encroaches this area. Which area? This area. The bulging happens here and the nerve roots are here. So it is compressed here. So whenever there is a compression, all this becomes what? There is a severe spasm on both the sides. So arterial circulation to this area becomes what? Collapsed. And because of this collapse in the arterial circulation in the spine, here you can see annulus, right? The liquid. And this is the fibrosis. So whenever there is a wear and tear, what happens? This disc becomes, the disc is intervertebrally repaired, right? It is intervertebrally repaired and it is called, क्या टर्म है मैं भूल गया, क्या बोलता है इसको?
So, Shivani?
Yes, sir.
Fibrosis. Yes. It is called fibrosis. Annulus fibrosis. So, because this area, you see this area, right? This area becomes hard, right? So, the nutrients are not supplied to this disc. And whenever there is a mechanical pressure on this area, further herniation, extrusion, and sequestration takes place. The disc does not damage at one, right? It damages at multiple levels. And this is the roots where it is compressed. So all these things can be recovered to a certain level with MES also, and post MES also you will get lot of complications, and spinal surgeries you will find lot of complications, and that is here is the importance of what? The recovery of the patient. So here you can see facet joints are osteoarthritis. So here you see facetal atrophy, you see na, in MRI? Yes or no? Any
Yes, sir.
physiotherapist? You see, this is a facetal osteoarthritis. It's a facetal arthritis, right? Here you see the images.
Yes, sir.
Can you see that? And this is also another reason of pain. So two things you have to rule out when you rule out the pain in a low back pain area. Facetal osteoarthritis, right? Then what are the other things you have to rule out? SI joint, sacroiliac joint. And what will you analyze? That there are various reasons of pain. And this is the facet joints of what? A football player. So you have to be careful. There is a problem. Always you see the disc, you never see other problem. And even if you see, you do not know how to recover. And so your cases are failed. How to open the pathways, how to improve the nutritional capacity of that area, the inflammation of that local area is reduced. And that is why you see a brigadier's wife has come, we have treated it, but then there was a misunderstanding, that's okay. But then I understood that the pain was not on the place where there is what you called ablation was done, right? Radio frequency ablation was done. Using radio frequency, the nerve roots were burned, right? But still she had a pain. She has received 5 blocks, caudal block and everything she received. But I treated the what? The sacroiliac joint and the facetal joint osteoarthritis. And immediately the patient got relief in 20 minutes. And by God's grace, she was not able to stand and sit, and she went walking. And I treated the patient only for 5 days. And total time of on treatment I gave was only first day 45 minutes, second day 20 minutes, third day 10 minutes. And then next round when they came, I just treated her for just 2 minutes, 3 minutes, 5 minutes. And then patient was totally okay. This is where you have to understand
Sir, first time
things
when
how
she
it is.
visited, she was on the wheelchair. She was not able
Huh?
to stand even.
Pardon me, Shivani ji?
The first time that lady, she visited first time to the workshop, she was on the wheelchair.
She was not even able to stand, right?
Yes, sir. And
And she was not even able to sit.
after the first session, immediately she got recovered and able to stand.
Hmm. And this is called facetal arthrosis, arthropy. You see, this is facetal arthropy. The joint inflammation.
The spine is not able to take the load. You see the very clear pictures. These are the roots, right? And that is why I say when you want to learn things, you should learn from a neurosurgeon, you should learn from a spine surgeon. When you want to learn from those people who can really make you understand what is the problem. So I'm just creating a foundation for you. So now one more important thing we will see in most of the cases, people get deficit, right? Can you hear me?
Yes, sir.
Am I audible? I don't know.
Yes, sir.
Yes, sir. Yes,
Yes,
sir.
sir.
Yes,
We
sir.
are audible.
Oh, it's 9:54. We'll close the class today, right? I'm sorry. When I teach, I don't see the watch. There are two problems with me. When I teach, I don't see the watch. When I treat, I don't see the watch.
Okay, sir. It's okay.
But you all have to see it because you have a lot of duties. My duty is night duty, so I'll be back to night duty. You may ask me a question, please.
So yesterday you were talking about trauma to the brain due to injury. So can that trauma
Your
result?
voice are cutting, madam. I don't know what is the problem.
Oh, you can't hear me, sir.
I am able to hear you, but in breaking.
Uh-huh.
You do one thing. You close your what you called video, and then you speak. Maybe the voice will be better.
Or you can write in the chat box, ma'am. I can read the question for you.
Okay, I'll do that.
Can you hear me?
Yes.
I can hear you.
Yeah, please. What's your question, please?
Yesterday you were talking about traumatic brain injury.
Yeah, traumatic brain injury, right?
Yes. Can there be some neural pathways rearrangement due to the trauma, sir? By
Yes.
automatic.
No, the question is, if you leave automatically, it will become automatic system. Nothing can be done automatically, madam.
Uh-huh.
There
No,
is no auto
I
correction.
used to hear about a
See,
person
when
who
there is a
had a
TBI, you have to, everything is not like auto correction. The biggest mistake you do, people is doing three mistakes what you do in your life. What are they? If you see the patient is having a pain, not having a pain, and you see a disc lesion, you don't correct your life. You are waiting for the pain to arrive to correct it. In 70% people who have myelopathy and who become paraplegic, they don't have symptoms of pain. They have no radiculopathy. There is no nerve impingement, right?
Thank you.
You got my point?
Yes, sir. Yes, sir. Thank you so much.
Am I audible?
Yes, sir. You are audible.
Yes, sir.
You are
क्या आवाज
audible,
कट
sir.
कट के आ रहा है? You are, my voice is clear or it is cutting down?
Yes, sir.
Your
Yes, sir.
voice is
No,
very
sir.
clear, sir.
Sound is clear.
Loud and clear. Very good. So, how can you think that the brain can be auto-corrected? अरे नको 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 नको. In Hyderabad, we say नको नको. And hydrocephalus be auto-corrected without vent. अरे madam, patient will die if you don't put the stent with patient. Because the liquid will be accumulated in the brain and there will be large edema and the GCS will fall down. So whatever the extra fluid which is generated from the cortexes of the lateral ventricle, it has to go out from the urine and the vents are required. If you don't do that, the patient will die. It's not possible. If hydrocephalus is there, the accumulation of CSF is there in the brain, there is edema, and the solution is what? BP? Shunt. Shunting has to be done. More question, please. More questions, please.
Sir, yesterday you teach about
Anyone is staying near Delhi? Anyone is from Delhi? Anyone is from Delhi? पाटिल मेरा एक काम करना मेरे को एक मैग्नेटिक चश्मा बना के भेजो ना आई एम नॉट एबल टू गेट इट इन Hyderabad. I got it too, but I lost it. So it is like this, and then you put it like this, and you put it like this. Again, you wear it.
Yes, sir.
Magnetic चश्मा था -10 का एक मैग्नेटिक चश्मा बना के भेज दो. You can do it like this, and you open it, and again you close it, and you wear it. Right? You can see the
Yes.
classes of Sasi Tharoor. You will get the idea.
ठीक है सर.
वो मेरे को बनवा के यहाँ हैदराबाद में मैंने खोजा. They don't make it, and I don't get a time. So if anyone can get me magnetic glasses, I'll be grateful to you. Because yesterday I went in the ICU, I left my glasses, I came home, and then I realized I'm not having any glass. I was so involved with my thoughts. I forgot my glasses in the ICU. And then another brother, means the nurse, the male nurse from the ICU, he came and he said, "Sir, this is your glasses you forgot in the ICU." So it is very embarrassing situation for me because if I have to read the nearby things, I have to open my glass, I keep it like this, and then I read like this. So after reading, I'm involved with my thoughts because I give notes, right? Sastriji is famous for his notes. And in this note writing, I get involved with my notes and I forgot that I have glasses. Only when the people ask me, "Sir, where is your glasses?" I say, I don't know where I kept it. This is the problem which Sandeep faces every day. That did you forget in the ICU? I don't know. If I know, why will I ask your help? Even in Gurgaon, it is happens with me, you know. I forget the glass and then I call the cleaner. Please see my glasses. I ask my student. I don't know where I have kept the glass. Please search. So Sachin, it is a regular duty of the Sachin to see I keep my glasses properly before I sleep. So this is not Alzheimer. It is the involvement of your thoughts, right? So you should identify the procedure which has been post injury. So you must know what is the procedure, how it was done, and without procedure, can the patient be recovered? What kind of procedure you should plan? What are the problems you are facing? It should be specific, Baba. What you are doing right now? Agram bagram chakkam chu. I don't understand what is agram bagram chakkam chu.
Traffic police.
I call your procedure as agram bagram chakkam chu. When this people bring so much file, I always say, what is this? So some juniors they ask me, sir, what is this? I say Agram Bagram Chakkam Chu. So what do you mean by Agram Bagram Chakkam Chu? That means I also don't understand what they did. I have to give my thought analysis. And that is the difference between you and me. I analyze a situation where it has gone wrong. And then I discuss with the MRI, with the radiologist, what is the level of the fascia they have damaged? What is the surgical damage they have done? Whether the implant is creating the damage, whether the pressure on the vertebra is creating the damage, what is creating the spasm? First, identify the problem, and then accordingly you do brain mapping, and the problem is solved. In 80% of the cases, the problems are solved. So I don't understand why you are afraid of surgeries. I don't understand why you are afraid of recoveries. I see fear in your mind in both the way. And that is why I say, Satya se tamaso ma jyotir gamaya. Ma mrityor ma amritam gamaya. Hey, asato ma sat. मतलब मुझे there was a song which we learned in our childhood. ले चल प्रभु मुझे सत्य की ओर, असत्य से सत्य की ओर। ले चल प्रभु मुझे शांति की ओर, अशांति से शांति की ओर। नहीं? So this song was the inspiration song which always inspired me from this journey to this journey. Fear to flow. That is why if you ask me what is the subject topic of your fellowship, I'll always say fear to flow. How to overcome your fear and how to go in the rhythm of the flow. And that is called NIBS. The power of NIBS. Even after 25 years, I say, I am the first one who don't know what is NIBS. I'm the first one who's the student of the class, and I'm still the student. I did not pass my class. And that is why when IB Cherian was asking which certificate should I give you after 15 years of your fellowship with me, I said, sir, I don't know. Because even now I don't know what is the power of NIBS. Still I'm moving in what? To find out the problems and the solutions. I am successful, I am failure, but every failure makes me a stone heart to be successful person. And that is why I am very, very specific, very, very what you call it, little shrewd. Because every unsuccess on my part, in camp you will see I am very in treatment. I always encourage the people to practice near me. But when you practice near me, I see instead of doing treatment, you get a buffet set. I told you just need to put 4 needles. You created the buffet of needles. And then you put the picture in the group and you say it is city guided procedure. I said it is city guided or a buffet of the marriage. So it's up to you आप क्या समझना चाहते हैं किस तरह से करना चाहते हैं दुनिया आपकी है आपने बनाई आपकी दुनिया आपके ऊपर प्रभु आपको सत्य की ज्योत जगाए अंदर में कल्पनाएं दें may your mind be full of knowledge skill and this is what I say encourage people to study so that when you study when you see the problems you can
Under
solve
your
the problems
guidance, sir.
बेचारा पाटिल का नुकसान हो गया आज
Under
कैन यू
your
हियर मी
guidance, sir. Journey will
Yes,
be.
sir.
बेचारा पाटिल came for learning I made his a loss of 1000 rupees for my and the specs and if anyone is possible you buy me one good glasses why this one is very old
I will send you in few days.
I say okay but then also you can send me some glasses I don't have time to buy the frame. I don't know how to purchase online also. I tried, but everything was failure.
वही करने
So
का
she take the photo of my face and send me what you call the uh, one frame and good glass
जो अभी
minus
हम लोग का
10.
कंडीशन मेरा जो चल रहा है ना उस हिसाब से सारा में छोड़ना पड़ जाएगा लगता है
छोड़
जो
दीजिए
क्या वो गुप्ता जी किसको छोड़ेंगे
काम
मेरे
बढ़ाएंगे
को
तो अच्छा रहेगा
देखो गुप्ता जी मेरे को छोड़ने की
बढ़ेगा
बात कर रहे
कमुआ तो
थे तो
पैसा आएगा तो अपन क्या करेंगे साले लोग
पैसा आएगा
ऐसा आएगा तो
पैसा
आगे
आएगा
चलेगा
तो
बढ़ेंगे
अपन क्या करेगा पैसा आएगा तो चलेगा हम तो यहाँ मुफ्त की बात कर रहे हैं हम तो मोदी पार्टी है मुफ्त में बिजली हम तो केजरीवाल पार्टी है
कल
ये तो पैसा
जाना है
देने की
थाना
बात
ना
कर रहा है
जाना है
गुप्ता
थाना
जी
ना नहीं तो फिर मैडम के यहाँ ना जरा जाना है मैडम ने फोन किया तो जरा एक बार जाके उधर भी जगह देखे ना उधर
सर
अच्छा जगह है नई बस्ती है
सर
बहुत भीड़ भाड़ एरिया है वहीं से
सर
दुकान
गुप्ता जी
डालते
की
हैं
बात तो सुनो
सर
वन
मालूम है
मिनट वन
सर
मिनट वन मिनट गुप्ता जी की बात तो सुनो चलेगा क्या गुप्ता जी पैसे की बात कर रहे थे थाना जाने की बात कर रहे वो भाई बोल रहे थे सासू जी को थाना भेजना होगा पुलिस स्टेशन है
हाँ
घरी पहुंचा जिससे चकाला
अरे
मरोड़
वो
लंका से
गुप्ता
मैंने
जी
लेप मारा वहीं पर लगा हवा कम हो गया बोला कि साला गाड़ी क्यों ऐसा हो रहा है
गाड़ी का ये हो गया ले मारा
आज
ले दुश्मन
कल ये देखो
वहां खड़े भगवान बजाए गुप्ता जी से, ले मारा, ले दिशो,
Abo,
बाई तरफ से ठोका,
celebrity
दाई
movie.
तरफ से
Oy
थाने
baba.
में गए।
Oy.
भगवान बचाए हमें गुप्ता जी से, शिव गुप्ता जी से भगवान
उनको
बचाए।
मेरे पास
इनकी
एक
ड्राइविंग में मैं तो नहीं जाना। हाँ?
Bro, range no. অত্যন্ত
चलो
সুন্দর।
इनको म्यूट कर देते हैं।
हड्डी पड़ गया
ওই যে মানুষগুলি আসতো, সেলফিশ আসতো, বাস
हाँ,
আসতো।
आस्क मी क्वेश्चंस प्लीज।
हाँ सर,
गुप्ता जी से भगवान बचाए, पैसा और थाना,
হ্যাঁ,
दो चीज से भगवान बचाए। वो तो टेलीफ का जगह ओपन सर्जरी कर रहे हैं। हम लोग बोल रहे मिनिमल 1 करोड़ की मशीन, 5 करोड़ की मशीन में लाने की सोच रहे, रुपए लाने की सोच रहे। ओ भाई साहब तो करोड़ों की बात कर रहे हैं, हमारी बात तो नहीं है। हम तो मिनिमल इन्वेसिव की बात कर रहे हैं। सुबह जाओ, 2 घंटे में सर्जरी कराओ, और शाम को अपने घर में बच्चों के साथ खाना खाओ।
কাবাবটি। রাতে কি খাইছি? ওই যে আরো
है
আরো
ना?
খাবো।
हाँ,
চিন্তা করো না।
हमारे बांग्लादेशी भाई साहब सारा समय अनम्यूट करके अपनी बंगाली भाषा सुनाते रहते हैं। हाँ, आस्क क्वेश्चंस एंड विल स्विच ऑफ द
हाँ
कैम।
सर,
योर क्वेश्चंस
कल,
प्लीज।
हाँ सर, कल के क्लास में सर वो
हाँ,
अपने पार्ट 2 डायबिटीज और पार्किंसन का कुछ कॉम्बिनेशन है क्या सर, मतलब
अरे
पढ़े
भाई
थे नहीं?
मैंने इसको एक खाली एक तकिया कलाम लिख के समझाया। कैन यू हियर मी?
अच्छा, मैं एक्चुअली वो समझ।
यस सर, यस।
यस सर।
Parkinson means what? Reduction of insulin inside. In, diabetes means what? Depletion means reduction of insulin inside the body, so that the sugar is not converted to the carbohydrates and energy level, right? ATP and all other molecules. Low level. तो इंसुलिन उसको शुगर को कंट्रोल में लाता है, राइट? इन योर लैंग्वेज।
हाँ,
वैसे डोपामिन अगर रिड्यूस हो जाए
तो स्टेज
तो
कम हो जाएगा ना सर?
तो फिर आपका हाथ का ये पु 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 चालू हो जाएगा।
हाँ,
हाँ, उसको आपके हाथ में ये आ गए
अच्छा,
ट्रेमर्स।
कम हुआ।
हाँ, कंपास।
ओके,
बट इफ इट इज इंटेंशनली, आप जानते हुए आप कप उठाते हुए कर रहे हो तो उसको इंटेंशनल ट्रेमर बोलते हैं, और जब आप रेस्ट पे करते हो तो उसको पार्किंसन बोलते हैं।
अच्छा, तो मतलब सर जिसको टाइप 2 डायबिटीज होगा उसको चांस ज्यादा है पार्किंसन का?
साहब टाइप 2
पार्किंसन।
डायबिटीज वालों के लिए तो सारी दुनिया खुली है। ग्लूकोमा से लेके, किडनी से लेके, हार्ट से लेके, लिवर से लेके, ब्रेन से लेके, आंख से लेके, हार्ट से लेके, नर्व से
सर
लेके, मसल से लेके,
आई।
सबकी 12 बजा सकते हैं आप। जिसकी 12 बजानी है उसकी 12 बजा दो आप।
जी सर।
वह तो खुला दरवाजा है, उनकी भाभी है भाई, जिन्हें बुलावा भी। डायबिटीज इज कॉल्ड व्हाट? वेलकम to all diseases. In Haryana it is called गांव की भाभी सब है, जी का बुलावा इनका सब है। मीन्स जिसका घर में जाएगा उसका घर का सत्यानाश कर देगा। So control your diabetes, live a healthy life, don't allow Parkinson to happen, clear your G lymphatic system, chant the name of God, do good breathing exercise, live a healthy life. Why do you have Parkinson, Baba? Insulin come, diabetes high. Dopamine come, Parkinson high. Topic over. भाई जो सिटी में रहते हो मेरे को चश्मा तो गिफ्ट करो भाई, मेरे को बहुत प्रॉब्लम हो रहा है। एक दो चश्मा स्पेयर होने से अच्छा है। कभी कहीं छोड़ के आ जाता, कभी कहीं छोड़ के आ जाता। मैंने लेंस कार्ड से ट्राई किया था ऑर्डर देने का, बट मुझसे नहीं हुआ। आई डोंट नो ऑल दिस स्टफ। आई ट्राई 2 आवर्स बट मुझसे नहीं हुआ। फिर मैंने बोला भाड़ में जाए, वो एक आध गुरु दक्षिणा में चश्मा भेज दो। और पाटिल जी कौन सा चश्मा बोला एक बार शशि थरूर का देख लो, वो ऐसे मैग्नेट का जैसा आता है और ऐसे लगाता है। और भैया ब्लू डॉट से भेजना, ब्लू डॉट से भेजना, ये रजिस्टर कोड और स्पीड पोस्ट से मत भेजना। 25 दिन लगाता है वो लोग भेजने में। अभी 1 घंटा लग गया मेरे को चश्मा खोजने में, मेरे रूम में कहाँ था। कम से कम 3-4 चश्मा हो तो तकलीफ नहीं है, एक हो गया तो दूसरा निकाल के पहनो, फिर खो गया तो फिर तुम लोग गिफ्ट करो, नहीं तो तुम लोग को पढ़ाएगा कैसे। कम से कम 5-6 चश्मा होना चाहिए हमारे पास। गुरु दक्षिणा में चश्मा दो, दानम शरणम गच्छामि। तुम मेरे को चश्मा दो, मैं तुम्हें ज्ञान दूंगा। चलो भाई, ये आज की क्लास पूर्ण विराम हुई। बिस्मिल्लाहिर्रहमानिर्रहीम, वाहे बरकतुल्लाह वाहे बरकतु। मालिक आपकी रक्षा करे, एक ओंकार करता निर्भव ओम। सर्वे भवन्तु सुखिनः, सर्वे भवन्तु निरामयाः, सर्वभद्राणि पश्यन्तु हाँ। चिंतामणि मोहितो इज टू लेट फॉर टुडे एंड टू अर्ली फॉर टुमारो। क्लास में जाते वक्त आ गया अटेंडेंस मारने। प्रेजेंट, ही आर सेइंग बाय बाय सर, टू अर्ली फॉर टुडे एंड टू लेट फॉर टुडे एंड टू अर्ली फॉर टुमारो, राइट। इसको हम लोग क्या बोलते हैं, भगोड़ा। क्या बोलते हैं क्लास का,
Thank you.
भगोड़ा।
Thank you
हमारी
so much,
भाषा,
sir.
in
Thank
my
you, sir.
language we call it what, bunker. Bunkers of the class. In morning you will, in the beginning of the class you will show the face, and then the end of the class you will show the face. So in between you are not there. Bunker. Patil is still called. He came to me 8 years back. He bunked my class, and up to 9 years happened. I am calling him the bunker of the class. The last bench bunker. Your impression is not changed. Still is called the bunker of the class. Right? तो जय जगन्नाथ। जगन्नाथ प्रभु तुम्हारी
जय
कृपा
जगन्नाथ सर,
रखो जी।
नमस्कार, नमस्ते सर।
Thank you, sir.
जगन्नाथ प्रभु तुम्हारी कृपा रखो जी।
Thank you.
Thank you, sir. Thank you.
Thank you so much, sir.
Thank you all of you, right?
Thank you.